of my mind, body, and soul.
For me, self-care means community care.
I practice self-care by regular breast self-examination.
I practice self-care by creating or joining spaces that allow me to express myself.
Self-care is all about prioritizing me time.
I practice self-care by choosing to use a long-term birth control called an IUD to prevent pregnancy.
Hello, I'm Christy Cade with the White Ribbon Alliance.
And I'm Cindy Garson, Coalition Director of the Self-Care Trailblazer Group. We are thrilled to welcome you to the Self-Care Learning and Discovery Series. We are a global coalition dedicated to ensuring everyone practices self-care. We advance self-care advocacy, evidence, practice, and learning to support people meeting their own health goals and to strengthen health systems.
The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. The series has invited more than 50 organizers from around the world to share what self-care means to them in practice through 16 individual sessions. While each session examines self-care through a unique lens, they are very much connected. We encourage you to participate in as many as possible.
The Discovery Series is open to everyone: advocates and activists, healthcare providers, government officials, program implementers, community members, because all of us should have a vested interest in self-care. We hope you share your own ideas and insights throughout the series and keep the conversation going by becoming a member of the Self-Care Trailblazer Group. We'd like to thank the members of the Self-Care Learning and Discovery Series Steering Committee, Advanced Family Planning, JPIGO, PATH, Population Services International, and most of all, White Ribbon Alliance. Without you, this learning opportunity would not be possible.
We also want to thank all of the session organizers who have dedicated their time voluntarily to curate this event. We should also say that each of the organizers took on the responsibility of the content in individual sessions, and so they might not necessarily reflect the views of the steering committee. Please take what you learned today and apply it to advancing policies, programs, and practices that enable self-care, universal health coverage, and your own individual health and well-being. Now, without further ado, we turn it over to today's session organizers. Thank you.
Thank you and enjoy.
Hello, everyone. We're just waiting for my co-host Fatimata to join. So I thought I would jump in and start proceedings while we're waiting to sort out a few things. So I'm delighted to be here today. My name is Judy Stenmark, and I'm the Director General of the Global Self-Care Federation. So I would like to say a big thank you to the Self-Care Trailblazer Group and the White Ribbon Alliance for supporting these series of webinars in support of International Self-Care Month and International Self-Care Day. And of course, I'm delighted to be co-hosting this with Fatimata and her team from the Senegal Self-Care Pioneers Group, and also REF ESPF. So perhaps, Nana, we could go to the next slide. Here we are. Okay, so as you know, this session is all about transforming opposition to support. Next slide, please. And so just a little bit about who we are. We are a global trade association, and we represent associations and manufacturers in the self-care industry, and we're committed to better global health outcomes for all. And we work closely with healthcare professional groups, with relevant stakeholder groups such as the Self-Care Trailblazer Group, and really about delivering for patients and consumers better choice, better care, and better value. And just to let you know, we have been in official relations with WHO since 1980, in fact. So next slide. So on this slide, really just to highlight two things: our purpose and our vision. This is our North Star, if you like. And really, we want to ensure evidence-based self-care products and solutions are recognized as key contributors to health for individuals and health systems worldwide. But really, what's our vision? A healthier world through better self-care. And only can we achieve that by partnering with trusted global stakeholders, such as the ones we're partnering with today. Next slide, please. So I think some of you would have seen this session description, but just to start the ball rolling and before Fatimata comes on, You know, we all know self-care is not new. It's been around for a while, and there is a growing worldwide movement in support of self-care. But even with that, it's not where we want it to be, and it's not embedded in health systems as it should be. And there are many misconceptions around the concept of self-care and also the benefits that self-care brings to systems and patient health outcomes and consumer health outcomes. And that's why, hence the title of this session, Transforming Opposition to Support. And we at the GSCF believe that one of the most effective methods or ways we can eventually get there and transform opposition to support is to demonstrate the value of self-care by showing the evidence for it. What's the evidence on a social level, a health level, and an economic level? And then this is the sort of evidence and data that we can use with policymakers to try and change hearts and minds. So in this session, from the GSCF point of view, we will be highlighting current evidence on the benefits of self-care from our new report, which will be launched in the next few months, the Self-Care Readiness Index, which we are doing in collaboration with WHO, and also highlight a recent study from our European member that is really highlighting and has delved into the socio and economic benefits of self-care on a European level. So that's all I wanted to say. We will have speakers coming up, but I'll hand over now to Fatimata to introduce herself and her session.
Merci à Julie. Donc, c'est un grand honneur pour moi de me retrouver aujourd'hui parmi vous devant cette éminente audience et pour présenter en matière d'auto-soin. Donc, le réseau je représente ici le réseau des femmes sénégalaises pour la promotion de la planification familiale. Et le réseau est très heureux de pouvoir participer à cette session sur l'auto-soin, transformer l'opposition en soutien. Nous avons pu avoir l'opportunité de participer à cette session en co-organisant la réunion avec le Self-Care Global Federation et avec le groupe des pionniers de l'auto-soin au Sénégal, dans la série des webinaires initiés par le White Ribbon Alliance et le Self-Care Trailblazer Group. Comme vous le savez, le réseau est une organisation de femmes mise en place depuis 2005 et qui travaille dans la promotion de la planification familiale pour la santé de la mère de l'enfant, mais également pour l'autonomisation des femmes et pour le renforcement de leur leadership. Nous avons notre action est une action de plaidoyer et notre plaidoyer vise entre autres les décideurs, dont les parlementaires, mais également les élus territoriaux pour une meilleure prise en compte de la planification familiale, de la santé de la reproduction dans les programmes de santé et de développement du pays. Vous conviendrez avec moi que en tant qu'acteur dans la planification familiale, que nous ayons une attention toute particulière à cette série de webinaires sur l'auto-soin. Nous savons que l'auto-soin est l'une des meilleures stratégies, certainement, pour une meilleure prise en charge adéquate, efficiente de la santé de la population par elle-même. Et les méthodes de planification familiale permettent, comme le DMPASC, permettent effectivement cette prise en charge pour une meilleure confidentialité, mais également pour une meilleure utilisation de manière continue des méthodes contraceptives modernes ou de longue durée. Vous savez également qu'avec la situation que nous sommes en train de traverser aujourd'hui, avec, comme on dit, la troisième vague de la COVID-19, les structures de santé sont éprouvées. La session d'aujourd'hui porte donc sur l'auto-soin, transformer l'opposition en soutien. En d'autres termes, transformer les réticences, parce qu'on a assez qu'il y a beaucoup de réticences, transformer les réticences en adhésion. Donc, c'est un travail qui nous incombe à tous et que nous devrions mener ensemble. Et sur ces propos, je voudrais remercier l'ensemble des équipes du Self-Care Trailblaze Group, du White Ribbons Alliance, de la Self-Care Global Federation, du groupe des pionniers de l'auto-soin au Sénégal, et remercier tous nos partenaires qui ont soutenu nos actions jusqu'ici. Je vous remercie.
Okay, so after the WHO released their first guideline on self-care for SRH in 2019, a global advocacy movement began to ensure countries advance policies and programs that support individuals to practice self-care. So we saw significant opportunities for self-care in Senegal, and the Ministry of Health has long demonstrated leadership in advancing contraceptive self-injection, DMPA-EC. And as our self-care advocacy began, the first cases of COVID-19 were reported in Senegal, and we adapted and maintained the momentum of self-care, but also ensure it was a key part of COVID response. And that positioned it for better visibility. Our first goal was to increase and build champions for self-care, as well as highlight its important role during the pandemic response. So we hosted an educational symposium in early March 2020, where we highlighted existing self-care programming being led by partners group in WHO representation to present self-care guidelines and emerging evidence, and made space for early commitment from the MOH in Senegal. So building on this momentum, a core group of the symposium attendees met virtually in May to prioritize and identify national advocacy priorities. We leverage a global advocacy roadmap for Senegal and for self-care, developed by White Ribbon Alliance on behalf of the Self-Care Trailblazer Group, which had already been used in a number of countries to identify advocacy priorities. Participants agreed that a national working group was needed to advance a self-care guideline in Senegal. And so we launched the Senegal Self-Care Pioneers Group in International Self-Care Day in 2020. And under the leadership of the Ministry of Health, Family Planning Division, and with the participation of WHO Afro. Goals for the group, the Self-Care Pioneers Group, include those you see and which is mentioned in these slides. So we learn more on what self-care might be in Senegal by organizing a series of consultation with civil society, healthcare provider, and decision makers, and conducting a situational analysis of policy environment in Senegal that could support self-care, and as well as a mapping of stakeholders. Now we have begun the process of elaborating the national self-care guideline, which include NCDs, non-communicable diseases, SRH, HIV, etc. And the new revision of the WHO guideline in 2021 comfort us in the way we have took on a global vision of self-care for Senegal. some achievement to share. We are proud to say that the civil society in Senegal, under the work done by the Self-Care Pioneers Group, has adopted a declaration to advocate for self-care. And about this group, the Self-Care Pioneers Group, there are great organizations implicated in this group from the Ministry of Health. We can talk about the Family Planning Division and Non-Communicable Diseases Division. For the civil society, we have a religious component, youth, family planning users. We also have association of patients for NCD, cancer, diabetes, HIV, NGOs like FHI 360, PRB, Soltis, ASBEF, PAF, ACDEV, and other as Réseau Sigil Jigéen. We also have professional association like public health workers or women medical doctors. So it is a very large group we are proud of, and we invite all organizations who are interested to join this movement to contact us. So thank you for your attention, and I'll stop this.
Thank you, Ida. Thank you very much. We're changing the order slightly. So next we are going to go to Juan Thompson. Juan, are you ready?
Yes. Hello, Judy. How
Hello.
are you?
So let me introduce Juan. Juan is the Director General of the Latin American Association for Responsible Self-Care, known as AILA. And Juan and his organization are a major member of the Global Self-Care Federation. So we're delighted to have Juan on board today and talk about our Self-Care Readiness Index, our new program and report, if you like, that we are very excited about. So over to you, Juan.
Thank you, Judy, and thank you very much for the invitation. It's a pleasure to be here today to talk about this important milestone for the Global Self-Care Federation and all its members. As Judy mentioned, my name is Juan Thompson. I'm the Director General of the Latin American Association for Responsible Self-Care, LAR, and also board member of the Global Self-Care Federation. So maybe we can go to the next slide for the presentation, please. Next one, please. Thank you. Next. Yeah. So first of all, you are probably wondering what the Self-Care Readiness Index is. So basically, this is a research and advocacy tool that explores key enablers for self-care across selected health systems around the world. And also, this is part of the collaboration plan that Judy was mentioning before with the WHO, the World Health Organization. So next, please. What we want to achieve with this, what we want to achieve with this specific tool is to provide policymakers, decision makers, and healthcare professionals with data, and also with a learning platform to inspire new approaches to self-care. Next, please. How we are going to use this specific tool and index and information. Well, for the first time, we have a specific self-care practices mapped around the world. So we can use this information and be able to see the country's progress with self-care, and also highlight the best practices that have been identified to think about opportunities for improvement, and to use these examples also to move forward with the self-care strategy in different countries around the world. Next, please. In this first part of, next, thank you. In this first part of the study of the self-care index, we are covering 10 countries. And the idea is, of course, to increase the number of countries in the future editions of this study. Next slide, please. Next one. To be a little more specific about the geographic scope of the self-care index, basically we have included 10 different countries that were selected for the different 6 regions considered by the WHO. So you can see here we have in Latin America, we have Brazil, we have the United States in North America, we have United Kingdom, France, Poland in Europe, China and Thailand in Asia. And also we have 3 countries in Africa, Egypt, Nigeria, and South Africa. Next slide, please. So the self-care index is measured by 4 key enablers. The first one here is the stakeholder support and adoption. And here it looks at the level of trust and adoption of self-care among healthcare systems and providers around the world, patients, consumers, as well as regulators and policymakers. The second one is more focused on the individual empowerment and the practice of self-care. So here, what we measure is the level of health literacy, for example, the knowledge of health interventions, the confidence to make their own decisions, or their own health decisions by individuals as well. In the third pillar, in the third enabler, we have self-care policy. And basically here is the inclusion of self-care in health policies at national level, as well as the incentives available for in public policy for increased self-care practices as well. And the fourth, which is the regulatory environment, it looks at the regulatory process of self-care products in the different countries, such as, for example, the reclassification of over-the-counter molecules, also advertising and information, access channels. So here we also consider in-store or online access channels for these self-care products. And all these factors will support individuals to take care, of course, to practice self-care by their own, right? So if we move to the next one, please. Yeah, we can move to all the, because I think that, yeah, perfect. So regarding the methodology, this is a very important topic because when the index was designed, the Global Self-Care Federation and the WHO agreed to put in place a strong methodology with different data sources, as you can see here in the slide, but also with clear and measurable indicators, and as well as a review committee of experts on self-care. So as you can see here, the data sources were quantitative service, which was the 20% of the report, 30% of qualitative interviews, and also 50% of desk research. Regarding the indicators, each enabler that was mentioned in the previous slide is supported by different indicators that are coded on a 4-point scale. So being 1, not self-care ready, and 4, very self-care ready. And regarding the review and alignment, I think this is one of the strongest characteristics of the index, since the WHO has been actively involved in the process of the study, as well as this creation of an expert advisor committee formed by high-level experts of self-care around the world. And also all this review process of the information provide us credibility and legitimacy as well. So also some of these members of the expert committee will be ambassadors of the index with the presentation that will take place, as Judy mentioned, in the next month. If we move to the next slide, please. Thank you. Which are our key findings regarding the self-care readiness index? As you can see here, we have a specific score for each country. However, I would like to highlight here that the focus on the index is not just to show a number or a score of readiness. As we have mentioned before, the idea here is to learn about the practices, the processes, and the opportunities to increase access to self-care for our populations. So next, please. We have some relevant findings regarding the self-care index. First of all, Some internal ones that are basically, we have now documented proof of what we already knew regarding self-care readiness in different regions around the world. And also the point that I was mentioning before as well is that this collaboration, this process of collaboration and endorsements for the WHO and the Expert Advisory Committee was really important and helped us to address this gap of information regarding the initiatives of self-care around the world. That I think it's very important for us to think together about the future of the self-care strategy and implementation. Next, please. Also, we have specific findings regarding the countries. And here is interesting to see that most countries demonstrate similar scores and levels of self-care. And basically, the differences between countries are highly influenced by cultural approaches, right? So the understanding of self-care, the definition of self-care in different cultures is very important to be highlighted here, because it's a point that we need to work together, right? Because creating a common global understanding of the self-care's benefit will help us to realize its potential and support healthcare systems around the world. And also we have here self-care practices identified that are very useful and that we can use an inspiration to other countries that maybe in this part are not included in the index, but we will also try to include in future editions of the report. Next slide, please. So the information included in the index implies a call to action to improve self-care around the world and with the support of different stakeholders as well. So there are three key points that can be highlighted from our findings. First of all, we have self-care, which is culturally relative and defined in several ways. So here, I always like to say that self-care is a movement, right? So if we, and we really need to work all together with different stakeholders to recognize and show the value of self-care. Then later today, Jurate is going to explain us a little bit more about this value, not only social, but also economic. And also we need to work together to improve these four enablers that were mentioned in the beginning of the presentation. And here I think that developing a new global compact of self-care and also having the guidance of the WHO on a self-care resolution are really, really important milestones for the Global Self-Care Federation, but also for the strategy to move forward with self-care in different countries. The second point here is to individual empowerment. So here, individual empowerment depends on health literacy, access to credible sources of information, and aligned healthcare professionals. We all agree here that education and access to information is a key enabler for self-care adoption, right? But for that reason, I think that the quantity and the quality of information that must be available for the patients should increase. And also the digital health solutions and the digital health transformation that we are seeing more now with COVID and the pandemic can play a central role to support this specific objective. Also, healthcare professionals are key partners in the self-care strategy, and they need to be educated as well on self-care practice to provide guidance to patients. And the third one is regarding self-care legislation. And here we have seen that the self-care legislation is common, but it's not fully connected with other government strategies. So I think that we are all agents of change, but we need to build this broader alliance with the stakeholders, including policymakers and different government offices to advocate together for an effective and integrated self-care strategy. Next, please. So as I have mentioned before, the full report will be launched in September, during the General Assembly of the United Nations. However, I would like to present you an example of the information that will be available in the report. So we have selected today an example of the enabler 4, which is regulatory environment. And as you can see in the graphic, we have 4 specific indicators. The first one is the approval process. And here we consider the level of efficiency and clear regulatory process for approval for self-care products. The second one is drug reclassification. We call them switch. This process, we call it switch. And basically, it's the need of a clear regulatory pathway for the reclassification of molecules from prescription to over-the-counter, non-prescription. And here, this part of the process is essential for the innovation and the access to new products for consumers and patients in our countries, right? Then the third one is access and distribution channels. And here the idea is to evaluate the level of access to self-care products that the countries allow. So here we have a variety of channels that go from in-store or online. And this is very important also more with the pandemic, because we have seen a lot of changes around the countries, not only the ones included here in the index, but also in different regions around the world. And the fourth indicator here is advertising and pricing. Here, it's really important to guarantee that consumers have the information they need to take healthy decisions. And also, which is the role of advertising, for example, to provide this kind of information to the consumer about the use of the specific over-the-counter medicine, or even any other data that it's important for them to use that product. And here, I would like to briefly comment some examples that we have in one specific country that, as you can see here, Brazil is one of the leading countries regarding this enabler, and is basically the country where I'm based. I had the chance to participate in some specific regulatory activities with this process of self-care adoption. And for example, regarding the indicator 2, which is drug reclassification, we have been working with the National Regulatory Agency in Brazil to approve some years ago a new regulatory process for reclassification of molecules, over-the-counter molecules, with the purpose of increased access to consumers and also to allow innovation of new molecules. And this was a very interesting exercise, because the National Self-Care Association here in Brazil worked together with the regulatory agency to build a software that was used to evaluate pharmacovigilance data and provide more information to them to take that decision of reclassification of the molecules. So that was a very good example of a practice and a collaboration between the different stakeholders to provide information and to approve this new framework for a regulatory reclassification of molecules. Also here in Brazil, the over-the-counter medicines pricing control was eliminated last year, following some relevant studies that were conducted with important universities here in the country, and that showed that the possibility to have or to eliminate the pricing control was creating a scenario where the pricing of or the price of the over-the-counter medicines will be reduced. So this was also a very important example of collaboration with universities, with the Self-Care Association, and also with the regulatory office in Brazil. And regarding the access and distribution indicator, currently there is a discussion here in Brazil in order to modify the distribution channels for over-the-counter medicines, and it's under discussion in the Congress. And the purpose here is to allow OTCs to be sold in other channels besides pharmacies, for example, supermarkets and e-commerce platform. And here, this is a discussion that has been very influenced by the pandemic because of the need to allow new access channels for medicines to the population. So regarding the call of action of this regulatory environment enabler, I think the learnings from Brazil and the examples that I have mentioned before is that we really need to work all together with the health department, with regulators, with manufacturers to ensure that consumers have access to the products they need and the information they require to practice self-care. So next slide, please. The official Self-Care Readiness Index launch will be on the 22nd of September this year in the context of the United Nations General Assembly. So we are really happy to present this information, and there you will have all the details of the report with the specific countries and all the enablers. So on behalf of the Global Self-Care Federation and ILAR as well, I invite you, all of you, to join us and work together to advocate with this tool for more self-care in our countries. So thank you very much for your attention today. I'm happy to answer any questions you may have. Thank you very much.
Thanks so much, Juan. And we will have questions and opportunity at the end of all our speakers to talk more about this. I hope everyone's enjoyed that sneak peek into the index. You just saw a little bit of it, but Juan gave a great overview of everything that's happening. And so we'll be talking more about that, and you'll hear more about the launch and all the activities we have. But I think people can see that this will be a really fabulous advocacy tool to use with your policymakers in your respective countries. So thanks again, Juan. We're going to our next speaker now, and it's my pleasure to introduce, we should go to the next slide, thank you, to introduce Jurate Svarcaite, who is Director General of the European Association of the Self-Care Industry, AESPG, another leading member of our organization. And they have just completed a major research study on the economic and social value of self-care in Europe. And I think we can take a lot of examples away from this. And in fact, we are using it to do now a global study looking at how the Europeans did it and then enlarge it to all our regions. So Jurate, I will hand over to you.
Thank you very much, Judy, and good afternoon or good morning to everyone that is joining this webinar. I would like to go to the next slide immediately, and similar to Juan, I'm going also to provide you a sneak peek rather than actually the final product. The study, the first part of it is done. So we have tried to quantify the economic value of the self-care in Europe and looked at what the potential for it is. And the second part of the study is to look into what actually are the incentives for more self-care from the policy perspective, as well as from the different stakeholder perspective. So very similar also to sort of what is done through Self-Care Index, but more looking into the best practices that are happening in Europe. So actually what I'm going, and you can go to the next slide, what I'm going to share with you today is more, and next slide please, is a sneak peek. This hasn't been published anywhere. And this should stay between us, but I'm sort of very happy to share this if it inspires any other region for actually the learnings of what the extent of the self-care is in the European region. So just quickly to say that the AESPG is the European equivalent of GSEF. We exist to advance responsible self-care, and we do believe we do so by enabling citizens to take better care of their health needs. And at the same time, a big mission of ours is contribution to sustainability of European healthcare systems. And sort of the second part has encouraged us to go and look and measure what our contribution of our industry on our products is to the health systems, and also look at what is potential, and which is very relevant today in the light of the pandemic situation which we are in, to see what the potential contribution could be there and what resources could be actually sort of released if more self-care was practiced by the citizens in Europe. You can go to the next slide. So I just wanted to share with you a couple of numbers before I dive into sort of a model which we use to quantify the value of the self-care by using the self-care products. So just a quick sort of reminder, and I know that this does not exist in all the countries worldwide, but in Europe we have a very clear demarcation between the prescription medicines and non-prescription medicines, or otherwise very often called over-the-counter medicines. So actually, if we look into just volume of packs, and I have to recognize that non-prescription medicine packs will be always smaller than the RX medicine packs, simply because this also is one of the ways to reduce the way that people could unresponsibly use them. But if you look only on the mere numbers, every second pack dispensed in the pharmacies in Europe is going to have a non-prescription medicine status. We also count more than 1 billion packs of minerals and vitamins that are purchased every year in Europe to supplement the sort of healthy diet. And we also maintain an ingredient database at AESPG, which lists all the ingredients that are available without the prescription in Europe. And currently we have more than 200 active ingredients. Not in all the countries 200 exist. Unfortunately, even the most proactive and the most sort of self-care ready countries have around 130. So there's still a possibility to learn from each other and to have more ingredients available without prescription to sort of practice and enable self-care. And typical ailments that you could treat in Europe without actually going and seeing your doctor would be allergies, gastrointestinal disorders, cuts, bites, rashes, cough, and cold, which is one of the most popular ones, and definitely pain. So we can go to the next slide, and I am diving in directly into the sneak peek of how we came about to estimate what the value of the self-care is today in Europe. And we sort of developed this model together with the researchers that did this research for us. And we have compared sort of two scenarios. One scenario is you have a sort of an ailment and you decide to use a self-care product, either by going into a pharmacy and buying it, or maybe you have it already readily available in your home medicines cabinet, or you turn up into the GP's office, into the family doctor's office, and you ask for the sort of medical intervention, and very often you will be prescribed something, and sometimes you can also be recommended an OTC product. So what we did, we have looked into how much it's saved by people actually practicing self-care compared to if these people ended up in the formal healthcare system and we're going to use basically consult the doctor for their minor ailments. You can go to the next slide. We have looked into Europe, which for us, it's European Union, so 27 European Union member states, but we also, in the membership of AESPG, have the UK, which recently left, unfortunately, European Union, also Norway and Switzerland. We did not do the calculations for all the individual countries. We have extrapolated and created some kind of grouping of countries, and I will show you that we ended up with 11 countries on the basis of several economic parameters. And then we looked and sort of estimated based on these country clusters the value of the self-care. You can go to the next slide, please. So there, for the basic parameters, what we looked at what the time cost for GP consultation was, what more or less the cost for a pharmacy visit, often in the time of minutes for a patient was. We looked at sort of how many prescription medicines were prescribed on average, how many OTC packs were bought by the population in average, and we also put money on the cost of 1 hour of medical treatment, so how much actually a GP sort of earns, cost on the hour of work of loss. So if you were to go and see a GP, very often You will try maybe to do it at the lunch break, but we know how it goes. Very often it extends beyond, so you also will sort of be absent from work. And we also added what it would cost if a product which is prescribed is going to be reimbursed from the national healthcare system perspective. So these were the basic parameters that allowed us to group European countries. And you can go to the next slide, please. And we resulted actually in 11 country clusters. So you see that some clusters, like the cluster 5, was very populous. We had a number of countries that fell into this cluster. But then, for example, if you look at the cluster 10, only Sweden appeared to be sort of very unique in the basic parameters that we use for the study. So these were sort of the country clusters that then we used to extrapolate the parameters and make our calculations on. What I wanted to say with this is just to say that every country is unique. However, you can sort of find the countries that can that perform or build their healthcare systems in a similar manner. Very often it is because of the politics, because of the cultural, historical background. And very often you see there are some patterns that we can actually identify in looking how they use self-care and how they practice it, and also how they build their healthcare systems. You can go to the next slide, please. Yes, this one. So actually, if we looked at the crude numbers that came back, so you see those numbers that are presented on the bars. This is the difference between actually a person practicing self-care versus a person going for the same minor ailment, being a headache, be it a cold and flu, be it, I don't know, upset stomach, going to see a GP. So obviously differences are quite significant. So in the country cluster 5, for example, a difference between the GP visit and the practice of self-care is 11.8 euros. And in the cluster 2, it will be 41.44 euro. Obviously, these differences also cannot be compared, because 11.8 euros in the country which GDP is lower will be maybe even comparable to a 41 euro in the country cluster, which has a higher GDP and also sort of a higher spending available to the citizens. So this is just to say that we try to avoid comparing countries amongst themselves unless it is within the same country cluster, which sort of has a very similar economic parameters. But you can already see that even in the country where the difference between turning up to your general practice doctor for a minor ailment versus doing and practicing self-care is already quite significant. 11 euros could be saved per each individual who decides to possibly take paracetamol for their headache versus turning up into the doctor's office. We can go to the next slide, please. So what we did finally, and this is the big numbers that I want to share with you, we have calculated that on average in Europe, we self-manage 1.2 billion minor ailments every year. So this is collectively, we are more than 400 million Europeans. So 1.2 billion minor ailments, we will self-manage ourselves by taking very often self-care products. And this results in the 23 billion euro savings for the national health systems related to time costs saved for physicians, treatment costs saved, also sort of any contribution that patient also has to pay towards the visit to see a doctor also is calculated into this. From national economy perspective, so this is related more to the fact that a person very often to go and see a doctor will be absent from work. Additional 10 billion euros are saved already today, because these 1.2 billion minor ailments are self-managed by the individuals in Europe today. These 1.2 billion minor ailments, we sort of derived it from the literature review which we did. And this sort of accounts to a few minor ailments per person per year. So I'm sure that you can imagine that having a headache and having a cold is quite common. And this is sort of a very conservative consideration of the average minor ailments that we would be self-managing. You can go to the next slide, please. Then looking into sort of health system perspective, I think the figure which we are very proud of is that because people can practice self-care by using self-care products, we actually can save 120 extra general practice doctors or family doctors, as they are called in Europe, that would be required if no self-care products existed. So this is just to say, if all the medicines in Europe were medicines that need to be prescribed by a doctor, we would be needing more than 120,000 more general practice doctors, or current general practice doctors would need to actually spend and work 2.4 hours extra every day in order to bridge this gap. So actually, we are sort of very, very happy, because everyone these days takes self-care for granted, because sort of, I mean, you have a headache, you have a cold. It's so usual to reach or go to a pharmacy that these numbers are sort of staggering and really overwhelming. But very often the politicians do forget them, because this is something which is so ordinary for us, and self-care is something which is sort of practiced without any deeper thought by many of us. You can go to the next slide. So I think the more exciting part is we looked at what is currently happening. This is the final slide on the numbers that we have for current scenario. So we have calculated that everyone who turns up into a pharmacy or takes something from their home remedy cabinet, they save average of 100 minutes per minor ailment of their own time. 20 minutes of this will be very often your working time. This is €9.30 in Europe, what comes to sort of working time calculation. And for national economies is €4.84, which is also quite significant, because you avoid this absenteeism from work. So actually every case of self-care saves €14.14 for national economies, because actually everyone sort of can carry on with their lives, because we have self-care products readily available. You can go to the next slide, please. So this is the more exciting part, which I wanted to say. We also looked at what is possible and what the potential is there. And we looked in it from the perspective of depth and breadth of the self-care. And what we mean by depth of the self-care is that actually we could manage more minor ailments by ourselves with these products that we have today. And what we mean by breadth is that we could have more products available without the prescription. I already mentioned at the beginning that we have 200 products listed in our database. But even the best in class, the country which has the biggest number of molecules available, has only 130 out of these. So there are still a lot of products that could be switched and made available without the prescription, which is sort of the breadth of the self-care which we mean in our study. So if you go to the next slide, so we try to think of sort of a conservative approach, how many more minor ailments we could manage with the current self-care options, and also conservatively how many molecules could be switched to enable more people to practice self-care. So this graph shows you in gray what are the sort of minor ailments that are treated without self-care, and those in yellow, different colors, show a different sort of product category, because we also are talking not only about the medicines, but also food supplements and medical devices. And you see that comparing, for example, in Norway, it's very, very low, where in Poland we have around already 50% of minor ailments are already treated with a self-care option, and less people go to see a general practice doctor. So this is also to say that countries are difficult to compare, because the self-care potential is very different in Poland compared to Norway. You see that in Norway there's much more sort of possibility to switch and to do more self-care by enabling more people to recognize their symptoms and do their own care. Please go to the next slide. So this is how the countries rank. So you see on the depth, you have a country ranking depending on what is the uptake of the current products. And sort of on the breadth axis, you see how many products are available OTC in those countries. So you see that, for example, United Kingdom, as I said, is one of the champions. It has around 145 molecules available as an OTC. And then you look in Croatia, which has actually 55 molecules available as OTC only. So you see that we also cannot, again, compare countries, but we can sort of estimate that the potential, for example, in Croatia, which has a little uptake, so a little depth and little breadth, has a greater potential than, for example, compared to United Kingdom, which is quite saturated in terms of already uptake and also of the molecules which are already available as a self-care options. So we actually calculated that the potential there is from 10% of growth to 25% of growth in those countries where little self-care is practiced and little number of molecules are available without prescription to the general population. Please go to the next slide. The one before, yes. So actually, if we sort of do the same analysis that we did for the previous estimation, where we looked at what is the current contribution of the self-care products to the health systems and the national economies, we actually calculated that in the very conservative scenario, which we call scenario 2, where more or less from 10 to 25%, and on average, we calculated 20% increase in the self-care. So 20% more of minor ailments would be managed by people themselves. We are calculating that it would increase the sort of the savings achieved by 48%. So additional 17.6 billion euros could be saved if more self-care was enabled. And as I said, sort of the potential in the countries is different. In some countries is greater than in the others. We can go to the next slide. And this is a similar comparison we looked. So what could be sort of the additional gains in terms of general practice doctors that are a scarce resource in Europe? We see the numbers of general practice doctors going down, and knowing that the population is aging very rapidly in Europe, and we will need to have more doctors to look after elderly population, which is also going to take a multiple medication. If this sort of self-care potential was released, we would save additional 58,000 GPs in Europe, or every GP could gain 1 extra hour in a day from their working hour to do something else, to either look after a more complicated cases and more patients could be seen by them, or maybe possibly having a shorter working days. So you can go to the next slide, please. And this is all I wanted to say to you. I know that I bombarded you with a lot of numbers. This is just a sneak peek of our study. We are very excited to come to an end of it. We hope that we will be publishing a final report sometime in autumn. It's one of the most thorough examinations of literature which we did, but also of this sort of magnitude of the economic modeling which we have done has never been done before. So I also have to thank the research group, the UVMI, that we have worked with, that has done this for us. And this is really exciting. And we cannot wait to actually have the final report and share it with our stakeholders, and hopefully to show that more self-care should be supported by the right policy instruments, that governments, when they rethink the health systems after the COVID, self-care is a huge potential saving which they could achieve if the right instruments were there to allow people to practice responsible self-care. Thank you very much.
Thanks so much, Jurate. That was really interesting, and I think there's lots of points from that, of course, that we can take and extrapolate to other regions, knowing that obviously every region isn't the same as Europe, but we can take what we can use and create different models in different regions. So we'll have time to talk more about that later. Jurate, since you just went and you're fresh in everyone's mind, I'd just like to ask you, have you done much at the moment on releasing your economic and social study? And if so, how has it been received in Europe at the moment?
So unfortunately, I will tell you, no, we haven't released it very far and wide. However, we had very recently, it's been already more than a month, we had our annual meeting at the end of May. It happened virtually, and we shared it with our membership and some of the stakeholders that also were part of that meeting. And to be honest, everyone got really excited, not only our own members, but also, for example, the pharmacists were very pleased with the results, because of course, it talks a lot, I mean, our study talks a lot about sort of directing people to pharmacies versus actually turning up into the doctor's office. So I believe that once we are going out live with the study, we will find a lot of stakeholders that will find the results very interesting, not only from the perspective of sort of greater self-care, but I think it's also we will be able to start a conversation of the broader rethinking of healthcare systems, and hopefully this will push to a discussion where we can discuss how self-care can become a pillar of the healthcare systems in sort of COVID-19 aftermath.
Okay, so I guess you've got big plans in terms of using it with European policymakers to really try and promote change.
Yeah, and beyond that, we also have our national associations, because we are very similar to GSEF. We have members. I mean, we have national associations that are members of ours, and they're also very excited to use this with their local policymakers, politicians, and governments, because, as I showed, the situation in countries is very different. So I think some countries will be starting conversations of more molecules to be switched, while some other countries are going to be talking how to enable and how to sort of make more people think self-care first. So I think it gives a lot of sort of food for thought for different countries, because the solution depends on where you are in sort of our ranking.
I think for Marta and others, we've seen with the pandemic, with COVID, that it's shone a spotlight on self-care and all the good things about self-care and how it can help us. But also, I think it's shone a spotlight on pharmacists and how they are a trusted source, but around the world, an untapped source perhaps, and that we need to do more to work with pharmacists to really try and drive self-care. Would you agree with that, Famata?
Yes, sure. I completely agree with that, because as you've said, with the pandemic, with the restrictions that we've had, people not being able to go out and get their medicine, let's say they've been really great actors, if I can say, and really self-care is something that is something where I can say pharmacists are really important in caring, in helping people have access to their medicine. We have as well the digital self-care, where pharmacists would maybe be able to direct patients, just give advice and be there for them. As with the pandemic, we know that we had so many restrictions, and they are great actors. We need to have them with us, and as well make sure the restrictions that we have, the barriers that we have, we overcome them for self-care. Thanks.
Thanks.
Hello, sorry, my hand can't show. I would like to add on to say that Africa is a big continent. It has 53 countries, so the variations are different in different countries. For example, in our country, in Zambia, we sell contraceptives, oral contraception in pharmacies, and the women can go and buy from them. We are also working on the self-injectables for them to be giving the DMPA in the pharmacies. But my worry is, like I've raised it on the question on the chat, that my worry is we need to take care. Self-care is the model we need to foster. And I'm speaking from a public health and nursing perspective. So it's a model we should push, but we should be, especially in Africa, we should be worried about abuse and misuse of drugs. For example, sometimes a person can go to a pharmacist and say, I'm looking for, can you give me amoxicillin, without a prescription. We don't even know what the person is suffering from, and that person is sold the antibiotic. So these are the things we need to be worried about. But otherwise, pharmacists, like in Zambia, we have pharmacists in our technical working groups. They participate and we are supporting what they are doing. Thank you.
Thanks, Peggy. Thank you for that. We have a question for Juan in relation to the index about what are the future plans for the Self-Care Readiness Index, and is there an intention to expand it to other countries, etc.?
Sure, thank you, Judy, for the question. Yes, first of all, we are really excited to have the final report launched to start our advocacy work in Latin America. I think it's, first of all, it's really important because we are going to have interesting examples on how the practice of self-care is taking place in different countries around the world. Here in Latin America, we have just one country included, which is Brazil. And the idea is to use these examples with other countries in the region. And of course, we would love to have all the countries of Latin America included in future editions of the index. But I think that the key point here is how we are going to use the index to build and to amplify our connections and our collaboration plans with different key stakeholders in the region. For example, we are currently working with the Pharmaceutical Forum of the Americas, which is the regional association for pharmacists in the Americas, not only Latin America, but including Canada and the US. And there we are seeing some data from the report that we are going to be able to use in thinking about, for example, the role of the pharmacist in self-care and how we can improve that role in Latin America by the inclusion of new guidance in the University of Pharmacists in Latin America, or even in the practice that they use in the pharmacies with patients, and the role they play in provide guidance to the patients regarding the correct use of the public health system. For example, when they can use over-the-counter medicines to treat minor illness or symptoms or when they need to go to the physician or the public health system to treat other conditions. Also, as I have mentioned in my presentation, ILAR, it's the regional association here in Latin America, and we are also in the process of establishing a plan of collaboration with the Pan American Health Organization, which is the Americas part of the WHO as well. So here also the information of the index will be very useful to think together with them with kind of actions we can develop in the region. And of course, as the other question, Judy, I think that having this methodology and this first example is going to be very useful for us to try to include other countries in the future and have a better picture of which is the situation of self-care in Latin America and how we can improve the strategy with the healthcare professionals, government, think about also public policy, which is something very, it's not very discussed yet here in Latin America in terms of public policies of self-care. So we are really excited. We are waiting for the launch in the United Nations. And we are, of course, going to work very hard to promote this information here in Latin America.
Thanks, Juan. And I think you threw up in your presentation, so did Jurate, and I think Fatimata mentioned this at the beginning, but the importance of enhancing health literacy or self-care literacy, as we're calling it now. And I think everyone in this session would all agree that it's so important to enhance and grow self-care literacy and health literacy. But what can we really do that's really concrete and will make a difference in this space?
Merci beaucoup, Madame Dem. Je pense que nous pouvons dès à présent passer à la prochaine question. Donc, oui. Nous avons plusieurs questions dans le chat et je vais adresser donc celle-ci à Ida. Donc, Ida, si tu es avec nous, on aimerait vraiment savoir quels sont les défis politiques actuellement liés à la promotion de l'auto-soin au Sénégal. Nous savons que le groupe des pionniers est en train de travailler depuis 2020 sur l'auto-soin et il est également en train de travailler sur l'élaboration du guide national. Donc, nous te donnons la parole justement pour parler de ce processus-là et de nous dire quels sont les défis. Donc, quels sont les défis politiques liés à la promotion de l'auto-soin au Sénégal? Et merci de vous mettre sur mute si vous ne parlez pas, s'il vous plaît. Merci. À vous, Ida.
Merci beaucoup, Farmata, pour cette question qui est très importante. Alors, pour répondre à cette question, je pense que je vais partager l'expérience du Sénégal. Effectivement, comme vous l'avez dit, pour le Sénégal, nous sommes dans un cadre où nous avons voulu promouvoir l'auto-soin à travers un engagement de l'ensemble des partenaires, que ce soit de la société civile ou du ministère de la Santé qui vraiment s'engage depuis le départ pour faire avancer l'auto-soin. Donc, concernant l'environnement politique, ce que nous pouvons dire, c'est que le travail que nous faisons permet aujourd'hui d'identifier l'environnement politique qui pourra soit promouvoir, en tout cas sous-tendre la mise en œuvre d'une stratégie d'auto-soin au Sénégal. Il y a déjà des expériences qui existent et nous nous basons sur ce qui a déjà été fait, notamment pour le DMPASC au Sénégal, pour en apprendre plus. Mais au-delà de la santé de la reproduction, il y a également d'autres programmes tels que le diabète ou le VIH qui font de l'auto-soin. Donc, toutes ces expériences-là nous permettent d'avoir une idée de l'environnement politique au Sénégal qui peut permettre de renforcer la stratégie d'auto-soin au Sénégal. Mais quelques défis, on peut relever quelques défis à travers les consultations que nous avons menées et toutes les discussions, non seulement avec les professionnels de santé, les partenaires et décideurs et aussi la société civile. On peut noter la première, ce qui revient souvent, c'est l'importance de clarifier que l'auto-soin, ce n'est pas de l'automédication. Cela est important parce que l'automédication pourrait être une mauvaise définition de l'auto-soin. Donc, il est important de pouvoir accéder aux produits, mais de manière sûre. Tout à l'heure, il y a quelqu'un qui a parlé de ce que les pharmaciens peuvent apporter dans l'élaboration de l'auto-soin. En tout cas, le fait de ne pas pouvoir, par exemple, faire le counseling et offrir les méthodes telles que le DMPASC en injection, cela pourrait peut-être être sujet de discussion pour lever certains défis et blocages à ce niveau-là. Il y a également la délégation des tâches. Je pense que comme beaucoup de pays, le Sénégal a travaillé là-dessus, mais dans le cadre de l'auto-soin, il y a toute une réflexion à avoir sur la délégation des tâches aussi vers les utilisateurs des services d'auto-soin. La gestion des données également est importante parce que l'auto-soin ne veut pas dire qu'on va sortir le patient, l'usager du système. Donc, il faut pouvoir capitaliser toutes ces informations-là dans le système d'information sanitaire du pays. Donc, ça constitue également un défi à relever. La place des acteurs communautaires de santé également, parce que l'auto-soin, c'est aussi beaucoup de prévention. Il ne s'agit pas seulement de l'accès aux produits, il ne s'agit pas seulement de l'accès aux soins, mais il y a également le volet prévention, promotion de la santé, et les acteurs communautaires de santé ont vraiment un rôle très important à jouer. Et donc, c'est une discussion qu'il faut cadrer et pouvoir assurer dans un environnement politique. Donc, cela concerne l'accès à l'information, l'accès aux produits également. Donc, nous avons vraiment une vision holistique de l'auto-soin qui devra intégrer beaucoup de composantes au-delà même de la santé. Et donc, en tout cas, dans le travail d'élaboration de ce guide sur l'auto-soin, nous essayons de mettre à plat tous les défis que nous pouvons identifier et en tout cas apporter un cadre politique qui permette de renforcer et d'assurer l'auto-soin au Sénégal. Bien évidemment, ce sera bien sûr à une prochaine étape, mais une fois que le cadre politique pour l'auto-soin sera bien élaboré, j'ai vu qu'il y a également un besoin de plaidoyer qui arrivera après, mais en tout cas, à l'étape où nous nous trouvons, je pense que le groupe des pionniers de l'auto-soin est très engagé dans cette élaboration de l'environnement politique à travers le guide national de l'auto-soin. Merci.
Thanks, Ida. Fatimata or Famata, would you like to tell us a little bit more about the Self-Care Pioneers Group now?
Sure, Judy, sure. Donc, I'm going to speak in French. Je vais parler en français. Okay. Et je vais parler justement du groupe des pionniers de l'auto-soin, qui est un mouvement qui a été créé donc suite à la journée mondiale de l'auto-soin et au symposium qui s'est tenu en 2019. Donc, ce que nous pouvons... Donc, ce que nous pouvons dire sur le groupe des pionniers, c'est qu'il rassemble vraiment les acteurs de la société civile. Nous avons également pas mal de partenaires d'ONG. Nous avons des associations donc, de prestataires qui sont membres de ce groupe-là. Et les objectifs, c'est vraiment de mener un plaidoyer fort pour créer des politiques et faire en sorte que l'auto-soin donc, soit vu comme incontournable comme stratégie au Sénégal. Donc, entre autres, les activités qui ont été menées et qui sont toujours en train de se poursuivre. Donc, nous avons eu une série de consultations, comme Ida l'a si bien rappelé, vraiment pour recueillir tous les avis et savoir justement quelles étaient les portes d'entrée pour l'auto-soin au Sénégal et comment faire en sorte que ce soit une approche incontournable. Il faut dire qu'au sortir de toutes ces discussions, ce que nous avons retenu, en tout cas pour le cadre du Sénégal, c'est que l'auto-soin n'est pas de l'automédication et que pour notre cadre, en tout cas, il faut qu'il y ait une certaine gestion qui se fait en parallèle par le prestataire de santé. Pas tout le temps, mais par moment, c'est nécessaire justement pour faciliter l'auto-soin et son intégration dans le système de santé. Donc là, pour cette année et pour cette période, nous nous concentrons principalement sur l'élaboration du guide. Et il faut dire que ce guide-là va permettre justement de dire quels sont les rôles du prestataire, quels sont les rôles justement des leaders politiques, quels sont les rôles des leaders religieux, quels sont les rôles des relais et comment justement chacun peut donc appliquer son rôle comme il faut pour l'auto-soin au Sénégal. J'aimerais également ajouter que au Sénégal, nous nous sommes vraiment inspirés donc, du guide de l'auto-soin, de l'OMS. Donc, comme vous le savez ou pas, il y a un nouveau guide que l'OMS, justement, a sorti ce mois-ci. Et ça nous conforte dans l'idée que nous avions dès le début de l'auto-soin, donc de faire en sorte qu'elle ne soit pas uniquement centrée sur la planification familiale, d'intégrer les maladies non transmissibles. C'est ce qu'on avait comme idée et ce que le groupe des pionniers avait comme idée au début de l'élaboration de ce guide pour l'auto-soin. Et le fait que l'OMS, justement, a sorti ces nouvelles recommandations en intégrant les maladies non transmissibles, ça nous conforte et ça nous rassure parce que l'auto-soin n'est pas seulement donc de la planification familiale, il y a beaucoup d'autres volets, c'est extrêmement large. Et ce que nous sommes en train de faire actuellement au Sénégal, c'est vraiment faire en sorte que ce soit formalisé, faire en sorte que la personne soit au centre donc, de ces guides-là et que la personne soit au centre donc de l'auto-soin. Donc, voilà un peu ce que je peux dire en ce qui concerne le groupe des pionniers et le travail qui est actuellement en train d'être fait. Merci beaucoup. Donc, je redonne la parole à Judy. Over to you, Judy. Thank you.
Thank you, Famata. Thanks for stepping in, because Fatimata has such terrible issues with her connection. So we have one last quick question, and it was really more to not really a question, but a comment from a member of the audience to say we must always be aware as well when we think about self-care and self-medication about abuse and misuse of certain medications, certain groups of drugs in different areas all around the world and also in developing countries. So I wonder who would like to comment on that. Perhaps one of the pharmacists online might like to comment on that issue, perhaps in the African region. Would anyone like to?
Yes, Chair. That comment is good for developing countries. We seem to have problems whereby controlled drugs are sold to individuals when they go to pharmacies to go and buy. Instead of presenting with a prescription from the doctor, the pharmacies tend to sell to them. I don't know for what reason. They don't even educate them or ask them for a prescription, they just sell the drugs to them. So this is one of the issues that we should be grappling with when we should be weary or be worried about abuse of certain groups of drugs.
Thank you so much for that comment. And I think with that, we are almost out of time. So I'll start wrapping it up and then I'll hand over hopefully to Fatimata to make some comments. But I'd like to thank all of you for your participation, but in particular our speakers today for giving their time and efforts. And I hope everyone has learned something or heard something new that perhaps they can take away and use in your own country or in your organization. And thanks again, of course, to the Self-Care Trailblazer Group and the White Ribbon Alliance for organizing all this. And I would like to thank in particular our partners, my partner, the Senegal Self-Care Pioneers Group, in particular, Fatimata and Famata. And from the Global Self-Care Federation, I'd just like to say, it's not too late to make your self-care promise, hashtag self-care promise. It's a campaign we've launched for International Self-Care Month to make your promise, your personal promise to enhance self-care. So with those closing words, I'll hand over to Fatimata, hopefully, or Famata. Thank you, everyone.
Merci beaucoup, Judy, et toutes nos félicitations pour avoir jugé demain de mettre la présente session. Et je voudrais dire que l'absence d'un alignement des pratiques médicales conventionnelles aux besoins socio-économiques, 15 à 80% dépendant de la de promotion de l'auto-soin gagnerait à intégrer cette considération socio-économique et sociologique à la fois, plutôt que de lutter contre la prévalence du modèle endogène qui, lui, est manuellement dépendant des critères d'auto-soin. Donc, comme vous l'avez déjà souligné, Farmata l'a souligné, Eda l'a évoqué, faire la différence entre l'auto-soin et l'automédication. Je pense que ce sont deux concepts qui qui s'apparentent, mais qui sont très différents, et donc des complications sanitaires sur tous les plans, et voir comment maintenant promouvoir l'auto-soin. On constate que c'est un concept multisectoriel et multidimensionnel, et donc qui implique l'ensemble des acteurs, où chacun doit la chaîne et qui doit jouer sa mission. Les organisateurs remercier dans l'ombre pour que notre session puisse être une réussite. Je vous remercie.